Hello, my name is Christine Tesmer. I am an RN. I am here to address Representative Jared Taylor about a bill that was sponsored by Rick Bratton of District 55. I am representing the bill HCR 16, which urges Congress to require healthcare providers to publish pricing information for healthcare services. One of the biggest concerns that my patients have is how much is this going to cost? Will my insurance cover this procedure or hospital stay? I have patients that refuse testing because of this burden. I work a lot of weekends at the hospital, and my patients are not able to contact their insurance company to get this information before having the procedure done. And several choose to leave the hospital, even though they need further testing done. This is a great concern due to the fact I work on a cardiac floor. And most of the time, we are trying to determine if the patient with chest pain is or is not having a heart attack, or if there's something else causing the pain, and if it needs to be addressed with urgency. The fact that people cannot plan for these procedures cause many to be unprepared for the cost, and as a result, causing a greater financial burden to the patient. There should be standard pricing for standard procedures. This information that I found on the Journal of Ethics talks about the amount that a patient may owe is further affected by the setting or location of healthcare services. For example, Medicare patients often pay a deductible of $1,260 for acute hospitalization, and then Medicare covers the rest up to 60 hospital days. But if a Medicare patient is seen in the emergency department and not admitted or is kept under observation status, he or she is technically an outpatient, for which the copayment for hospital services may be as much as 20% of the total charge. The observation status is another area that causes a great amount of stress for my patients. So beyond our monthly premiums that we have to pay, there's the deductible and then the total out-of-pocket cost. The deductible is how much you have to spend for covered health services before your insurance copayment company pays anything except for free preventative services. We have co-payments and co-insurances, which are payments you make each time you get a medical service after reaching your deductible. And then we have the out-of-pocket maximum. This is the most you have to spend for covered services in a year. After you reach this amount, the insurance company pays 100% for covered services. And this is found on www.healthcare.gov/choose-a-plan/your-total-cost. These costs can vary so much depending on the type of insurance that a person has. As a nurse, I understand that things can change in a second, but the equipment used, we already have a price that we pay for them, and that will be charged to the patient, just as we know the price of food items, cars, plane tickets, and even dental procedures beforehand. This information gives the patients the choice, and it puts the decision in their hands. So should be true with the cost of healthcare. This cost should not be adjusted or determined months after the fact. If my patients had an idea of cost prior to the test and knew what to expect, would ease a lot of stress of not knowing if they could afford it or not. I do understand that knowing the price beforehand would keep some who do not have the insurance for having appropriate procedures done, but I believe that the patient has a right to be informed of the cost prior to having procedures or testing done to them. Thank you very much.